Botox injections. The other girl does like facials, laser hair removal. So it's a little bit different, but they gave me a pretty good price on it. And I get my table, I have my squat rack, my gym mats, dump free weights, and we get to work.
Pretty cool. If you're cool with it, I wanted to ask you, are you okay with me recording this meetup?
Oh, yeah, of course. Yeah, go for it.
Yeah. And in the event that, because I don't know, no one else has RSVP'd yet, but I'm just going to let them come in as they do. But I'm going to do that and we'll just kind of talk freely, and just kind of chat and stuff like that.
Absolutely.
For sure.
If I take notes as well, in case we talk about just different cases.
Yeah, that'd be cool. That'd be awesome. Yeah. So, actually, an interesting case that I've been kind of asking around for different practitioners, something that I notice, is when someone comes to you and they say, hey, I feel weaker in one arm, right? And what is your first thing to think of when someone says that?
So they're weaker in one arm.
Mm-hmm.
Oh, my diagnosis in my head, or my follow-up questions?
Yeah, not really. Follow-up questions. Yeah.
Follow-up questions. Mm-hmm. I think I ask. It's okay, we feel weak. I always ask if there's numbness, tingling. Mm-hmm. Sometimes yes, sometimes no. Mm-hmm. But where I really like to ask specific is which fingers, because we have these two. You think, they say forefinger or thumb, you think radial nerve. You got the middle finger, you think kind of median, and you get pinky finger and you think ulnar. That's kind of how my brain tries to differentiate it. And I have a lot of guys that are in, jiu-jitsu, MMA, and 90% of the time it's I've got tingling going into my thumb. So you think ulnar nerve.
Oh, okay.
That's usually my follow-up is okay, numbness, tingling? Yes. If so, which fingers? I think another follow-up I like to go for is, do you have, you still have, grip in your hands? 99% of the time it's a yes, they still have it. Because some people come in and be I think I slipped a disc and now my arm's weak. It's well, can you still make a fist? Can you still punch? It's not true, true nerve disc herniation.
Mm-hmm. Yeah, that's interesting. I had encountered a client who came to me and she does a lot of F45. I don't know if you're familiar with F45.
Yes, yeah. Mm-hmm, mm-hmm.
And she came to me and was it just feels weaker and da-da-da. And so then I asked that same thing, but then I'm thinking, if I wanted to pivot to modalities, what I could use to try to get something to quote unquote wake up, so then I don't think she had said that specifically she had numbness, tingling, but it just felt like one arm was weaker than the other. And so my mind went straight to TENS to try to get activation up the chain. Yeah.
There you go. I'm in Washington. I actually went to school in Oregon. So in Oregon, I could dry needle. I could use TENS. I could use shockwave. Mm-hmm. But then when I moved up here to Seattle, their chiropractors are they can't do any of that.
What?
So I had to take out dry needling, had to take out TENS, and just find different things. So a lot of it is great. A lot of it. Do you have the 8-way heated scrapers?
I have seen them. I don't have one, but I have seen them.
I think you should get those. I'll send you the link here.
Okay.
Instagram. They've been a lifesaver in my practice. They're heated. They have a little bit of vibration to them, and it's way better. And I kind of miss sometimes the old school Graston, but I got to a point where I went, okay, what's the patient comfortable with?
Yeah.
Because there's my standpoint and then there's their standpoint. Mm-hmm. I'm at a point now where it's okay, I have to think what's comfortable for them.
Yeah, that's true. Yeah. That's a good point. Please. Yeah. Because
when I think I had another one. When I think weaker in one arm, when you were doing your palpation assessment, did you take a look at upper trap, rhomboid, down the scap?
Yeah, I mean, I'll look at range of motion, and I also want to see the actual strength of specific around the rotator. So testing infra, teres and things like that. and kind of like seeing some of that things. I wasn't really thinking like maybe she had a shoulder impingement per se, but you know what I mean? But I was thinking more along the lines of like, it could have been like some sort of nerve. Yeah. But like maybe she just hadn't reached the fingers yet, you know? So if it hadn't reached the fingers yet, it probably will later on down the road if I don't do something about it now, you know? That's where my mind went.
Was it, do you remember if there was any like specific movement that brought it on? Like, I know 45 does a lot of overhead press, or maybe she was in a plank too long.
I think it was overhead, because I had asked her, I was like, well, what are you doing instead of like the kettlebell, like overhead stuff? She's like, well, I'll just like substitute for like push-ups or something like that. And I was like, okay, that makes sense. Yeah. And she wasn't that old either.
Yeah. Because I have seen cases where people are like, you know, really overdoing it on that overhead press. And eventually, you know, if you're here, Lacey, you get this turn of motion too much, eventually something's going to pull right through here. Eventually that fatigue will kick on from the shoulder, and then your forearms, bicep, tricep start to compensate. They get really tight, and that sometimes can compress that nerve in there.
Yeah.
Sometimes. But
for some people.
That's just a longer way to think about it.
That's interesting. I like that. Whenever you think about therapeutic exercise, right? That's fast. That's for me. Like I have my strength coach, I have my corrective exercise, but I feel like you never stop. Like there's always going to be like, well, there's always more movements, you know, and there's always something to do for something else. And then how do you progress it if you want to progress it, right? What are your thoughts on like using therapeutic exercise in a manner with this?
I think it works perfectly. I think for me, I think we were talking about DNS a little bit not too long ago. When I've watched a couple of their videos and have had friends try to teach me. I'll be honest, it's a little overcomplicated. I think it's complicated just for me to understand. So I kind of deviate away from that and try to go towards more strength and conditioning. One, because it makes sense in my head. Two, what is a patient going to do at home?
Yeah.
So you want to spend your time, you want to gear your time towards, you know, some DNS of, prone 3 months, supine 3 months, or do you want to be like, hey, when you go to the gym tonight, let's try a modified overhead press, let's add scaption raises. You got to think, what are they more likely to do? So, and if I was a patient, I wouldn't want to be doing prone 3 months, something. I would rather do some scaption raises and a modified overhead press.
Right, like a landmine.
So that's kind of my approach to therapeutic exercise, but everyone's also different. You have the people that are like have acute injuries, like take hip flexor, for example, really easy. Start with hip cars and isometrics, and then just kind of work your way up from there.
Yeah.
Compared to people that are like, I had a guy come in, a Taekwondo guy come in Friday, and he was like, I just want some mobility back, because he's, just graduated college. He's now being introduced to corporate America, a desk job, so sits all day and then goes and trains from 6 to 9 p.m. And he's like a lot of my mobility is gone, and it's not really gone. It just he hasn't. He sits all day, then he goes to train at night. So
right, there's
just they want you, So then you want to look, trying to think. So then with cases like that, it's like, okay, you're already doing stretches. Let's take a look what your internal, external rotation and lateral directional preferences look like, and then we work up from there.
Yeah.
It just really depends on the person. It really depends on the case you have or what you have walking the door.
Oh yeah, absolutely. And that we can pivot away from like shoulder as an example to the big one that everyone has is like low back pain, right? And that's like,
yes.
I mean, oh my gosh, like I saw a study. I'm finishing my bachelor's right now. And I saw a study in class the other day that said that low back pain is linked to income. I thought that was interesting. Yeah.
Really?
Yeah, it was like linked to like if you're like making low income. And I was like, wow, that's weird.
Huh.
Yeah. Isn't that weird?
That is interesting. I can think, did they, I'm trying to think, how long did I guess like what were their control? Was it a systematic review or just like a survey?
Systematic.
Okay. What were they basing it on? Like low income versus high income, or
yeah, I think
certain job types?
I think it was more certain job types. And it was, like you're kind of going to that corporate America kind of thing where you're at a desk versus if maybe you actually have like more happiness in like what you're doing, And I mean, I don't know. Like I don't have low back pain. I mean, I'm still young, right? But like I don't have low back pain. And I'm hunched all day or I'm picking people up, I'm moving people, I'm still, you know what I mean? So I don't know. And,
no, I get it too. If I'm working like a really long week, like this week, I have a soccer game last night. I have to work another one today. Maybe at the end of the weekend, my back will hurt a little bit, but that's just because I worked 7 days a week.
Mm-hmm.
But we also, I think, because we're on the more with our jobs, we have more athletic based movements, so we know our body positioning a lot better compared to others. So you and I, for example, know how to hip hinge. We know how to do fencer stance. We know how compared to someone who doesn't do that all day every day.
Yeah. Right.
There was one guy I was talking to. He's another massage therapist, but he always comments on my Instagram when I'm doing soft tissue. And let me see his comment from last night. It was hilarious. He goes, "Excellent fencer stance and ergonomics." And I'm like, okay, so I'm doing something right.
Right. From a soft tissue perspective, that's funny.
Yeah,
wow, that's interesting.
It's like, okay.
Huh. Yeah.
It's just a video of me digging my elbow into someone's hamstring, and he goes, "Excellent fencer stance." That's where I got the hip hinge fencer stance idea from.
Interesting. Yeah. I wonder what state he's in, because and I'm in Texas, right? And here they told us archer. It was archer stance. So so that's where I'm like, huh. But it took me a second to be like fencer. Oh, I see what he's talking about. Like, yeah, that's interesting. Was that a big emphasis for you when you were in chiro school? Was like body mechanics like big emphasized?
It was. They definitely honed us in mechanics because most people coming out of chiro school are going to join. There was very few that went and just opened their own thing out of school, and then there was some people that jumped into like the higher end, like Chiro 1, the Joint, Arasti. And at those practices, you're going to be working on at least 40 people a day. So you got to get your economics right now.
Oh my gosh. I've my part-time job at the chiro clinic where I'm currently at, they do get that volume, I will say, but it's not like a Arasti or anything like that. It's like a family-owned thing, but they're just very successful. But for me as a massage therapist, it's more like I know I'm going to come here for 4 hours and I'm going to have 4 appointments. You know what I mean? Like, and they're back to back. Yeah. So it's like, instead of like me working as an assistant in the actual clinic, and I would be seeing like 40 people in my shift, I'm now seeing like a total of 4 people, and I am probably making a little bit more than what they're making. It's the way it is. But you know what I mean? So, but I do think that because there was a period there when I first worked here, they had me in the clinic, and I was still in massage school, and I got really, really good at confidence really, really fast because of it, if that makes sense. Yeah.
Exactly. Mm-hmm. Did you, were you chiro assistant or?
Chiro assistant.
Okay, nice. Yeah. And that's how we all had to start too, because when I was in chiropractic school, I also concurrently did my master's of sports medicine.
Nice.
So and they, we would start once a month, we were required to work at least 2 sporting events, whether that was rugby, soccer, I'm trying to think. Sometimes those ultra marathon events. Mm-hmm. I chose the soccer events because that's what I was good at. But you had to learn on the spot. Mm-hmm. Like as soon as you got there, our professor would be like, "Okay, you've got 5 people in line for ankle taping. Go." And I'm just like, "All right." But all the athletes out there, it's recreational. All the athletes out there are just happy that you're there, so they'll take anything.
That's cool. So it sounds like almost like low risk, low reward kind of thing.
Exactly. So I kind of had to learn by being thrown to the wolves. Which I was probably the last generation that could handle that. You and I were probably the last generation that can handle that. I can't imagine throwing this generation into that. They would freak out. They don't do well with that.
How old are you again?
29.
29. Gotcha.
Yeah.
Yeah, that makes sense. Yeah, no, because I had to kind of teach myself how to like KT tape and then certain ankle taping, flossing, things of that nature. One thing I really want to add to my repertoire soon is BFR. I'm trying to find
Yes.
somewhere to buy the actual like cuffs. I'm trying to find them. I know they're a bit pricey, but yeah.
I have the old school voodoo floss ones just from Amazon. I can't remember the company, but I can send them your way.
Yeah, be cool.
I use that in my office once in a while just because it's easier. It's also cheaper than the BFR cuffs. I know Val. Do you know the company Val?
Yes.
Yeah, they have blood flow restriction, but it's kind of pricey. Plus, you have to pay blood flow restriction itself, but then you also have to pay for the app every month.
Interesting.
To have it all work.
Interesting.
Because I would love, like, for example, force plates in my office, but I don't want to pay the subscription every month for it.
No. I have a friend who's a PT here in town, and when I went in and saw his clinic, he had those, the tools where like you press into it and it tells you the exact, its strength and things like that, or you pull, does the exact, but then when he started telling me how it works, like he pays a subscription to keep it, I was kind of like, oh.
Yeah, it's kind of like,
Yeah.
It's still a thought in my head that I would like to buy something from Veld, or at least have like a trial subscription.
Right.
But I also have to think down the road, it's like, okay, how much, you make X amount, how much is that going to cost per month out of my subscription? And yes, it's a tax write-off at the end of the year, but would I rather just have more take home?
Yes. Yeah. That's yeah. And it's just one of those things.
And I'm very new into the business world of things, so it's like,
yeah,
because we have a decent amount of Vald reps here in Seattle that are always trying to sell me something, and I have a feeling at some point I'm gonna fall into it.
How do you feel like going into business, and you're clearly very knowledgeable, but at the same time now you're entering this world where you have to dip into both, right? And it's like new waters, you know what I mean?
Yeah.
And so how have you been able to kind of like navigate and like try to like be getting comfortable with that?
It's still a bit of a trial and error of things. I had for a while, trying to think of like a good example. Like I have a partnership with one soccer team, for example. I go out and do their sideline work at their games, and then if they want to come see me in office, they get, a 10, and I don't take insurance, so they get like a 10% discount, for example. However, there was another, one of my best friends, we'll call him Coach D, had just started working for a really high-end high school track club in my area. And I wasn't super close with the head coach, but my friend was the assistant, so he's like, oh, come out, they're interested in a potential partnership with you. And that was not the case at all. They were very standoffish. They were very like, well, if I'm going to send my athletes to you, I want to pay just one amount. I want them to pay just one certain price per visit. And I went, that made me uncomfortable. I was like, I don't know what to do. This is a very on-spot thing. So I told them I would think about it.
Right.
Came home, I kind of felt, a little off guard. So I went home. I went, you know what? Let's just, think about this for a few days. So then I wrote them a proposal. Same as the soccer club I have now. It was, your athletes get this amount of time with me, this discount, and they just weren't. We just couldn't come to an agreement. So I actually dropped it.
Yeah.
Yeah, and I could, it's a really high-end track club, but I also, in that moment, was like, you know what? I value, my time. I know my credentials. Had I, fallen for a lower price, I probably could have gotten more athletes in, but I also was like, I know where I stand.
Yeah, yeah.
So it's hard to separate, my friend is still the assistant coach there, and I still love working with him, but, business is business.
Yeah, exactly. That's kind of how I've been I've had people ask me here, because I'm in Houston, like, oh, well, you should dive into like the bodybuilding scene and things like that. And then I'm kind of like, been to a couple events, and I quickly realized really quickly that I was like, yeah, I don't want this to be my niche, because like, you know what I mean?
What was kind of the, it's funny because I haven't been around bodybuilding too much, but what do you find the difference in like what like the niche that you would like versus what you don't like in bodybuilding?
Well, really, I just like athletes. Like you're doing high rocks, great. You're doing bodybuilding, great. You're doing powerlifting, you're doing strongman, like you're doing calisthenics, like whatever. Like I love it all. And I don't want to just be like, I just like these. I'm just like, dude, if you're an athletic person, it gets me hyped up because then I'm like, what are you going through and what are you doing? And then what can we do from a strength and conditioning perspective to push you in this better direction of injury prevention as well? But what kind of put me off with the bodybuilding thing was really more so observance of how there's a lot of cliques within the community that is bodybuilding.
Yeah, exactly.
And I'm an adult. I'm not in high school. So that's how I took it. Yeah.
Hey, it was that quickly you noticed it.
Yeah.
Wow.
Yeah.
Wow.
I went to one event, and I was like,
just working.
Yeah. I was like,
yeah.
I was like,
Yeah. That's kind of one thing I see too with certain sports. I have a lot of MMA and kickboxing people.
There you go.
And, everybody comes from different gyms. Mm-hmm. So it's nice to work with people from other gyms and watch their different training styles. Mm-hmm. But then you go to sports like track and field where it's very individualistic and, every coach has their different training style. Right. And it's almost a little bit toxic.
Yeah.
Just that little. And it's funny because, some of the head coaches are my age, and I'm like, guys, why are you acting like you're still a freshman at, NCAAs right now?
Yeah, seriously.
Seriously.
Yeah. And it's. I mean, whenever I used to coach gymnastics for a little bit, and I saw that the first time I ever did it, it was the coach who was yelling, like very angrily yelling at like 7-year-olds and like 8-year-old kids, like And like he's like, I need you to play good cop, and I'm going to be bad. I'm like, why do we need to do that at all? I'm like, I don't.
Exactly. So so then that brings me to a good point of it's some teams it's really hard to want to work with.
Yeah.
Because you've got a coach that expects one thing. Like for example, I'll take this track club example. Like when a head coach would call me, he would be like, oh, is there a certain stretch for this that he can get rid of this? And I was like, no, that's not how it works.
Yeah.
So it's just funny seeing the different education levels of who's been coaching longer. It's like stuff like that. Or just being on the same way. Like the soccer club I work for, the style of coaching is a little bit different. When the game starts, they're very quiet on the sideline. Like maybe once in a while the coach will yell an instruction out to the midfield, but that's it. And then you look at another team who the coach is yelling the whole time. Yeah. So I like to work with teams in which I agree with the coaching style. I don't know if that's being a little too picky, but
maybe not.
You realize you tend to get along. Like I get along with this soccer coach great because I agree with his coaching style, and it just flows better.
No, that's a great point. That's a great point of also I think a little bit of ethics because you're laying down your own boundaries and you recognize that I like this. And that's just what I've experienced works better for me. And, even if it's like the best team, the team that's winning and but the coach is just not flowing with you. Yeah. Just shouldn't, you know what I mean? You just shouldn't. Yeah.
And that's how I felt about the track club. It was a really, really good high school, like elite high schoolers, but I don't vibe with the coach at all.
It is what it is.
So that's where it's like, dang, do I want these high-level athletes? This is where business and athletics hit, and it's like, gosh, dang it. No one taught me about this. No one taught me how to navigate this.
Yeah, I mean, well, that's the thing about life, it's when the fun thing really about life is, especially in our field, I think you get to make these judgment calls, Yeah. And in my case, because like I have Houston is the type of city where you have to drive 40 minutes just to get anywhere, like around here.
Yeah, I live in Seattle. It's the same thing.
Oh my gosh, it's crazy. And so like I'm getting MMA guys from like 50 minutes out and I'm like, look, I know it's the drive. I understand. But if you want me to go to you sometimes, just make those compromises every now and again. You know what I mean? But
yeah. Do you, because I wanted to start this at some point, but I don't know if that'll happen. Like, you know, mobile work. Have you ever done that?
Yeah, I've tried it. It's not, well, if I'm pulling up to like your apartment, it's kind of weird. You know, like if I don't know you, it's kind of weird. You know, a little, but like I actually have a client he's a bodybuilder now that I think about it, but he doesn't compete or anything. So I guess maybe more of a recreational lifter, but guy, mobile, first time I ever met him, but I had him as a referral from another massage therapist. So I felt better to trust him. You know what I'm saying? And then now he's a lifelong client. Like he comes and sees me once in a while. So it's like, oh, okay, cool. But it's one of those things where, yeah, I see where you're coming from. Because also as a female too, I can see that too. Where you're kind of like, you know what I mean?
Yeah.
Yeah. So I get that too.
Yeah, because I've got one guy in the Bay Area. Maybe I'll introduce you guys on Instagram. He's a really good one. He does a lot of hotel room or apartment trips to like the 49ers.
Oh wow!
And I also had some scenarios where I've had to travel with or travel to different athletes. And when I first started it, I asked him, it's like, do you make them sign a consent form? Do you leave the door open? Like, what's kind of the scenario? He's kind of a cowboy. He was like, oh, I don't make them sign anything. Oh, no, doors closed sessions. And I went, okay, opening yourself up to some liabilities, but got it. Yeah. But I have a lot, when it comes to pros, I have a lot more female pros. So I think we're more comfortable with each other. So I always ask them, it's like, okay, everyone signs a consent form before any type of treatment. That's just the rule. I always, if there's another female in the room, that's fine. That's always helpful. But I always ask, do you want door open, door closed? What are you comfortable with? Right. Yeah, I try to keep it, if I'm doing any traveling or going to hotel rooms, I try to keep it female on female, unless it's a male that I know really well.
Yeah, that's a good point you bring up, because in my room at the gym, typically I watch the client. It more likely if it's female and I don't know them very well, like it's the first time meeting me, I'll watch them interact with the door, and then I let them, like if they're not closing it all the way, then I'm like, yeah, that's fair. I see where that's where you're comfortable, But if I've also had some females that I've met for the first time, and then they themselves close the door, then I'm kind of like, okay, that's,
right. I'm like, and it doesn't hurt to ever really ask either. Right. It's like, say, hey, what are you comfortable with? Are you comfortable if I keep the door open or closed during this session? It can just be as simple.
Yeah, that's actually, I'm gonna start doing that. Like, it just does. No, thank you. That's great. I like that. But kind of pivoting here, because I do want to talk case studies. That's the fun stuff. What is there any case study that you've come across in the last month where you've been like, oh, I'm a little stumped on that one, or maybe it's kind of like, ooh, I have to spend a little time thinking about that one?
I feel like what I see a lot of in the other clinic I'm working in is a lot of postmenopausal frozen shoulder.
Wow, that's a good. Yeah.
So frozen shoulder, because it's hard, because we're in that postmenopausal stage where we have that adhesive capsulitis, and they're like, I did nothing to hurt it, but I can't lift above here. Yeah, and if I try, it just really hurts. So then you have to think, you have to work the whole rotator cuff, of course. You have to work upper traps as well, because sometimes it does radiate all the way up to the neck. But you work on it for a couple sessions, and you could see either some really good improvement or some little to no improvement. Yeah. That's the soft tissue part of it. Right. Now, when I come to the rehab portion of it, a lot of it is just really trying to focus on passive and active range of motion. Yeah. Just trying to get, a little bit further overhead each time. Right. Trying to notice what else we do with that. Or to something really basic, like gapping the shoulder joint again with the Codman's arm swings. And then as they slowly get better, it's like, okay, let's start some shoulder stability. Let's add kettlebell, dumbbell, and see what happens, in internal and external rotation.
Yeah.
Right?
Yeah, definitely.
Yeah. I think if I have to pick a really hard one, it's frozen shoulder in women.
Well, yeah, definitely. It is not, I don't want to say rare because it can happen in men, but it's more likely, yes, in women. And then the older populations. With that, I've had my fair share of like my stab at like trying to be like, yeah, let's see what we can do from an exercise standpoint. Because like my first thing, obviously, yes, is the soft tissue, and you do that subscap release that everyone hates, and like everyone hates it.
Yeah, I can feel it too.
All right, and it's funny because when school, I was the demo for that. And I immediately regretted it. But I had my teacher, he like pressed like in here, he like brought your arm to shoulder flexion, of course. And as I got more and more into it, I saw that you don't have to just do this. You can also go this way, right? And so, because if they don't have that ability to even do this, right, and then you're kind of stuck as a therapist, you're like, what do I do? School didn't tell me what to do. You have to get things on the fly, and then you can go here, you can go down. You know what I mean? There's all different, planes, different motions and things. Yeah.
And you also have to think too, one thing in school they didn't teach you is, it's important for the patient to be comfortable. And if they're really honest with you and they're like, hey, I really don't like this, try different positions, across the body, or actually a really good one for getting in the lats and the subscaps. I have them just on their side.
Yep.
And then just kind of having them raise overhead, raise it, go across. Anything. So it's all about finding what's comfortable for them and being able to adapt. Because some people, the very rarity people, some people enjoy this, but a lot of people don't.
Right. Exactly. Every body's different.
Let's have you on your side. I'm going to place my hands here. We're going to do some movement through there.
Yeah.
That's kind of, being able to adapt is really important, which they feel like they didn't teach us a lot of that in school.
What are your thoughts on cupping therapy for like the cupping therapy guy on Instagram?
It's funny because I was actually supposed to go to his seminar when he came to Seattle, but I had an event to go to.
Oh.
I actually have tried. I'll be honest, I haven't really looked at the science. I've done general cupping, like dynamically.
Right.
Like, you put cups on like mid back and, keep them on for 5 to 6 minutes. I have started more recently some dynamic cupping. So like I put the cups on, let's say, I'm trying to think of an example. I had a guy where I put 2 cups on his rhomboids, and then I went, okay, we're going to go over here. We're going to do a landmine press, and I want you to feel the difference. Cups on, cups off. So just we get blood flow in that area, and it kind of helps give you that I think I did it for a neurosensory feedback standpoint, now that I look at it.
That's smart.
I think I'm at a point now where I can use it for 2 things. I can use it for relaxation, and I can use it for neurosensory feedback.
Cool.
So that's why I kind of like the cup guy on Instagram, because I do see that neurosensory feedback where it works.
Yeah, exactly. It's the small little good example of that. Recently, whenever I stretch people, you can do this like where you pull their leg across the body and like to try to stretch out that QL and a little bit of that glute, right? And I've found this little trick that I like to do with that stretch. Whenever you bring the leg across and you just have them kind of like laying like this, right? What I'll do, if it's more low back issue related, I will ask them to squeeze their heel toward their bum. So basically like squeezing my hand, if that makes sense. Yeah. And then once I started incorporating it into that stretch, now I've noticed when I'm cueing people to do specific things like a QL stretch on their own on a back extension machine, like a sideline like this, I'll have them squeeze their heel to their bum on that same side. And then it like enhances that ability to stretch that QL. You know what I mean? It's just small little things like that. You know what I mean?
Small little cues. And that's, that's where it helps that having that personal training and strength and conditioning background is being able to cue. Because I think that's the really big thing in this profession. I'm looking at and I'm like, oh, wow, I need to be good at cueing.
Yeah, I compete in calisthenic competitions myself as an athlete currently. And I'm actually gearing up for one in 3 months. And it's funny because my coach, he's a CSCS, but we're virtual at the moment, and it's different. I feel like when he sees me in person versus virtual for sure.
Right.
Yeah.
Right.
Yeah. What are your thoughts on that?
So, I mean, that is definitely, I've seen a lot of physical therapists do it.
Mm-hmm.
And I think and I know one chiropractor that does also do virtual appointments, but it's more rehab based.
Mm-hmm.
I think it can work because, I would like to try it someday. I think it can work, but there is definitely going to be a difference of in-person. There's always going to be a difference of virtual and online.
Yes.
It's never going to be, unfortunately, I don't think it's ever going to be the same. It's going to be a different experience.
Yeah. Yeah.
So that's still a realm I'm trying to explore as well. It's like, how would if I did, rehab online, how would it look?
Right.
Like, am I demonstrating? Are they demonstrating?
Mm-hmm.
Yeah.
And I see a lot of, I think this is a double-edged sword with a lot of practitioners, but I see so much like ATs, LMTs, chiropractors, but they'll sell mobility programs on like a website. And I'm kind of like, I don't know. I don't know how good that really is. What good is that really?
Yeah. I've actually I've seen that a few times, and it's like,
right.
You could offer it for sale, or someone's good. There's two options. Mm-hmm. Someone's going to find it on YouTube, mm-hmm. and they won't buy your program, or you could just have mobility appointments and charge a certain price for it.
Yeah.
Because that's the thing, is like one size isn't going to fit all. Mm-hmm. It's just not. Mm-hmm.
No.
Yeah.
No.
Because let's say a high level athlete buys that mobility program, and you see, hip 90-90s, hip cars, and they're like, wait, I already do this. Why did I purchase this?
Yeah.
It doesn't apply to me. Or it does apply to them, but it's already something they're doing.
Yeah,
I think it's always going to be a case-by-case basis.
Yeah, absolutely. Always. Yeah. And that's where we have, I don't know if you know her, Coach Casey on Instagram.
You'll have to send me her account.
For sure. She's here in Houston. She's an LMT and CSCS. She is hosting seminars and like CEUs where she teaches basic assessment courses, like non-diagnostic assessment. So it's like range of motion, it's manual muscle testing, and then she'll cover like scripting techniques, cupping techniques a little bit. And it's interesting because she said at the start of the last one I went to, she was like, there's a wild west of exercise on social media. It is the wild west out here. It's really like, what are you doing now? You know what I mean? Like, why? I saw a guy doing a hip flexor stretch on a pull-up bar and had a band attached to his ankle pulling him from behind, and he's like swinging his arm up or something, his leg up, and I was just kind of like, I don't know if I had to think about it. I was like, if I gave this to a client, how likely are they actually to do that? You know what I mean?
There you go. There you go.
Yeah.
Or like, I had a baseball kid come in. Oh, we can talk more about shoulders. Mm-hmm. He's young. He's 8th grader. Definitely that shoulder impingement. He can't, and he's a shortstopper, so he's not pitching like 120 a game like a pitcher. He's kind of just, fastball throws. But when I asked him, I was like, okay, does anything improve it or anything that make it better? And he goes, well, all the stretching I found on Instagram, it helped, and now it's not. And I went, okay, well, could you show me what it was? He grabs the resistance bands and just starts going crazy into external rotation. And then internal rotation really fast with the bands. And I went, okay, well, no wonder your shoulder's flaring up.
Awesome.
It's just constantly with the band, just resistance work. I went, okay, I was pretty direct. I was like, okay, I think we're going to take that out. But he just, imagine, that how he not found that on Instagram? Maybe his shoulder wouldn't be as bad as it was. I think it was TikTok. He's 8th grade. I think it's TikTok. Who knows? But still, just like, yeah.
That reminds me of shoulder protuberance type stuff, where
oh my gosh, yes.
So that reminds me of Whereas like, well, I mean, I think I've only ever given that to maybe like one person ever, but yeah, you just get the band, attach it to something, but instead of like pulling the band, you just have it like their hand, like the band is here, and then basically they just go back and forth like tapping.
Exactly.
Yeah.
Yeah.
Instead of like pulling the band like forcefully one way. Yeah.
So that's my example of wild west exercise.
I don't think I've ever given anybody this. Yeah. Thank God.
Maybe like an isometric. Maybe like I think I actually started. We're now at a point with him where we can do it, but we're doing it isometrically.
There you go.
So we're holding.
Yeah.
And then eventually, it's just easy resistance work. Mm-hmm. But the fact that that's what people are seeing on social media, and it makes it worse. It's kind of like, okay, all right, Wild West time.
Yeah, no, big time. Because one thing I really liked about that course I took with her, what really I walked away with was the fact that at the time I was studying for a strength coach cert. I have mine through NCSF, but once I get my bachelor's, I'm going to go for CSCS. But it started allowing me to start thinking within that framework, because every time I train now, before I train, I do these assessments on myself. You know what I mean?
Exactly.
And then now I can see, like, I know for a fact my right psoas, probably even right now, is tighter than my left. But then that makes my QL on my left going to be a little bit more tighter than on the opposite side, you know? So it's like, it's always this like, but now I know these things about myself, and now I know how I can start to address them over time. You know what I mean?
Exactly.
Yeah.
Exactly.
Yeah. Do you do that on yourself ever?
Sometimes, yeah. I do a lot of kickboxing, so I jab and I hook quite a bit, and it's just like, dang it, trying to think. I think it's just a really basic rotator cuff tendonitis. So I go, okay, let's do our rehab in the morning and kind of see where our limits are.
Yeah,
I do it all the time.
Nice.
Or it's like when sometimes I'll roll my own ankle in kickboxing and go, okay, here's our protocol. Let's go through nice and slowly. But for me, I know I can spot things really quickly, and I can fix things within 2 to 3 days.
It's interesting you bring that up. At the gym I work at, there's a kid. I say kid. He's a little younger than me, but he works front desk, and he was fixing to get ready to go to the military, so he started training for it. Pretty built guy, but never really great at endurance. Running, falls into a hole. Sprains his ankle. But he thinks, he was like, well, it could be a hairline fracture. And I was like, and so he had me look at it. I'm kind of like, okay, well, let's see what stability looks like. Let me see range of motion, things like that. And it's all bad. And I'm kind of just like, well, I can't.
Can you give me a timeline?
Yes.
Was it just the other day?
So it was, he like rolled it, let's just say February 1st. Let's just say it was February 1st. And then it had been going on until, let me like go on my calendar and like go all the way like February 1st, because now I'm like curious. It had like, let's just say, been going on for like the beginning of March, and sometime it like kept staying persistently to the point where he wasn't limping, but he had to keep wearing a brace.
Oh, okay.
Yeah. Like not like a thick brace or anything, but just like one of those like ones you can buy on Amazon.
A stability brace,
right.
Yeah.
And go ahead.
Oh no, you go ahead.
I think when I looked at his range of motion and stability and stuff, I was like, yeah, you should spend some time improving your stability, improving your ability to get that range of motion first. Don't just like start loading up 315 on the bar and then go for it, And I had recommended him to, he should probably look into imaging, MRI or X-ray. That way you really, really know if you're really that concerned. But I don't think he did.
Yeah, that's okay.
Yeah.
Was there any like limitations, like specific directions in range of motion, like inversion, eversion? Could he still dorsiflex, plantar flex? He
could not do dorsiflexion. Plantar was okay. And the way that I assessed a little bit of because I was curious about if it affected a little bit up the chain, like the tib. So I had him, I placed my phone against a wall, and the distance from like the wall to his toe, that was how I was measuring it. And then I said, try to get your knee to touch the wall.
Oh, yeah.
And so that's what I tried to get him to do. Couldn't do it. And so I was like, yeah. I live next to a fire station. I'm sorry.
No, it's okay.
But, go ahead.
Okay, I'm trying to think.
Mm-hmm.
Yeah, that's because with ankle sprains, trying to think because I work with a lot of soccer. It's they roll it a game, they ice it, they still take it easy on it. But the thing with ankle sprains is they're over 30 days.
Mm-hmm.
That's kind of when you got to think, okay, maybe imaging just to double check.
Right.
Because I had a pro soccer player for a while where she rolled it. Let's take August 1st, and thought it was just a general sprain, iced it, did all the rehab, felt okay, but it never got to 100% back. And then when I took a look at it, this girl had no dorsiflexion, no inversion, and I went, okay, something's not right here. And it just I think the trigger for me was every time she would play on it, or every practice, it would just swell up. So I went, okay, after 30 days, it shouldn't keep swelling up. So she got her own imaging through the team. There was no fracture, but there was a extensor retinaculum contusion, which basically means there's no blood flow coming back to that area. That retinaculum's, pretty much dead for a little bit. And all that swelling was coming from blood flow where it didn't know where to go. It had nowhere to go.
Yeah.
So like, oh, okay, this adds up. This is why you can't dorsiflex or invert, is because your extensor retinaculum is just dead. It's just
at the moment. Yeah. Well, modality-wise, at least for my brain, I would think like you could try BFR. You could also try cupping around it to try to get blood flow back.
Exactly.
Yeah.
Exactly. Because I think she was actually based out of Dallas at the time, and I was still here in Seattle. When she was going to PT, it was a lot of, range of motion. They were slowly getting her because they needed her to play. So they're going to do whatever they can to get her to load it to a moderate amount. And they were doing, red light therapy, all of that, shockwave as well. But I think in the end, it was just, so much damage. They went, okay, we're actually going to go in and do a PRP because we need to speed this up a little bit.
Yeah.
That's like the last case. That was like the last case scenario.
Yeah. I mean,
but like a general population person I'm not going to send them in for PRP if they don't need it.
No, yeah. Well, it's funny because the last time I had talked to him about it, he was like considering taking, and I'm not sure if you've heard of it, but BPC 157.
Yeah.
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 He was asking me, he was like, well, if I get it, do I like inject it straight into my ankle? And I was like, no.
Yeah, these are still around. I was going to get your input on it too. This is still around. I'm exploring is peptides and BPC because it is an injection. I haven't quite done my research on it. I'm still not know how I feel about it, but fighters that I know that take it, they love it.
Yeah,
they're not in pain anymore when they train. They feel stronger. But it is interesting. As soon as one of them can't afford it anymore and they come off of it, all of the general effects come back.
Yeah.
So now I think, okay, is this a long-term solution? Is this a short-term solution?
Yeah.
So I'm seeing the side effects when people come off of it. So like scary side, like we're talking headache, nausea, vomiting,
wow,
lack of strength. It's kind of like a withdrawal. Think of like a medication. It acts like a medication withdrawal. That's what it looks like. So now I'm kind of like, ooh, have we really done our research on this?
Yeah. So, the conversation I had with him a few weeks ago myself, I was working out and I had a dip belt on and I tried to stand up. I guess I didn't secure the chain properly. About 50 pounds of like steel, I have them around here somewhere. They're like steel weight plates, 50 pounds landed on my toe. It was my right toe. Yeah, it was bad. Yeah, it was bad. It was the type of pain where it went passed out and it went straight immediately to just numb, like straight away. So I started like immediately just went down and then I was like, put a little bit of weight on it. Okay, that kind of hurts. Okay, let's see if I can even lift my toe. Okay, I can do that. I was like, all right, well, we're just gonna have to wait a little bit here and see what happens. And so I needed to go to work. And so I like showered, did my thing. It started bleeding at the top, but not the nail. It hit just below the nail.
Yeah.
And so, which I thought was kind of weird, kind of lucky. And I immediately got to the chiro clinic I work at, and I was like, I hate to ask, but I need an x-ray. So they x-rayed right then and there, and they're like, nope, no fracture, nothing. And I was like, what? They were like, yeah, you're fine. And I was like, I dropped 50 pounds on my toe. And I was talking to this same buddy who rolled his ankle, and I was like, think of it like this. I was like, if you get on the BPC, I think that if like you were on it and then you were doing this incident, maybe nothing would have happened. I can't guarantee it, but maybe nothing would have happened. And then obviously you weren't on anything and this happened. So it probably just increases your chances of like having an external force coming in and hurting you. You know what I mean? Maybe, maybe we don't really know. You know what I mean? And so I was like, use at your own discretion. I'm not going to tell you that to do that or not to do that. I'm just going to tell you that you're an adult and you make your own decisions on that end.
Right.
Yeah.
Yeah. I'm not medical, so I can't give any medical advice or.
Right.
Yeah. Sometimes, like some people, like for example, some people ask me, "Oh, can I take ibuprofen tonight?" And I go, "I'm not medical, but do what you need to do." Yeah. So that's the same thing with BPC. I'm not medical. I don't know what's in the BPC injections, so I can't tell you to take it or not.
Yeah, exactly. And someone asked me,
but I can tell people the withdrawal symptoms, and I think sometimes that's enough to freak them out.
Oh, there you go. Yeah. Well, I mean, you could tell anybody like a lot of things like that. Like human psychology is crazy, but like I'll usually before I do any cupping, I'm always like, any blood thinners, any heart problems, blood-related issues I should know about, da-da-da-da. You'd be surprised the amount of clients I have who are like, you are the first practitioner to ask me prior to doing cupping on me if I have any blood-related issues. And I'm like, that's scary. Like,
yeah, that is scary.
Yeah.
Yeah, because in my general intake, I always ask, any any medications that you're currently taking. Because I also have a lot of teenagers that are on, oh my gosh, what's that antidepressant, citrulline?
Yes, yeah.
I have a lot of kids on citrulline, and there is actually some correlation between joint pain and citrulline.
Interesting.
And just general overall fatigue with citrulline. So it's like, okay, it's just something to keep in the back of my head of like, okay, could this also be a multifactorial, issue? Oh, yeah, you have a general injury, but you also taking citrulline, which doesn't help with the healing process.
Yeah.
But yeah, so it's just keeping different medications and their side effects in the back of your head is always a good idea. Or I'm trying to think of another medication. Blood thinners also cause a lot of general joint pain.
Yeah. So
you're on blood thinners for long term and you just get random joint pains. That's not uncommon.
I had a gentleman once, I hadn't seen him in a while, but it was at my other job, and it was interesting. He was an auto case, and comes in about weekly, and he was telling me like, yeah, I'm on these blood thinners, and I keep getting these crazy leg cramps every single night when I take them. And I was like, I don't know what to tell you there. All right. This is kind of like, okay.
Yeah, it's like, you might want to check with medical, make sure it's the right dosage.
Yeah, exactly. Like you might be, or something, Because
it is, when I had a blood blood clot in the back of my shoulder many years ago.
Wow.
And when I was on the blood thinners, I would get random cramps in different spots.
Yeah, that's interesting.
And I'll be honest, when I talked to medical about it, they didn't have an explanation for it. They just told me, cramps can be a side effect. Okay. Perfect.
Here's a banana. Up your potassium.
It's like up your potassium, and then I'd be like, it really hurts. Can I get a prescription for massage therapy or physical therapy? And they would be like, I was young at the time, 25, and they're like, no, massage therapy will make it worse. And I went, at this point, nothing could make it worse besides this medication. So I actually went to massage therapy while still on blood thinners. That's what helped decrease all that pain.
Well, it's interesting we're talking about this because the cupping therapy guy, Chris, his name's Chris. I don't want to keep calling him that because he might see this, but you never know. But basically, I had a conversation with him when I first took his class, and I had this kid who and I say kid like my age. I'm not a big guy or anything. I'm not overweight, but like he was not that either. He was a pretty thin dude, but he had a pacemaker. And I was like, whoa. And I was like, hey, are you on blood thinners? And he was like, no, but I'm supposed to be. And I was like,
ooh.
I'm sorry? He was like, he was like, well, you know what I do instead? And I was like, what do you do instead? He's like, I just drink alcohol. I was like,
okay.
we're not gonna do any cupping, no scraping on you today. We're just gonna all ART everything. That's just stretching you. That's And I messaged Chris and I was like, hey, really like what are like the extremes of like the cupping with like the blood thinners thing? Like let's just say you do cup somebody like with blood, like can you kill somebody? Like you know what I mean? And he was like, no. He was like, as long as it's not anything of like this dosage of warfarin or anything similar to warfarin, you're okay, but you still shouldn't chance it. He's like, just to be on the safe side, like I still wouldn't, you know? He's like, but like, he's like, if you accidentally, and just ask them, and if they say it's not warfarin, you're probably okay, but still don't chance it. And I was like, okay, well that's good. That's good to know.
I'm that same way too. You know, any person that comes in that says, and it's the same thing with chiropractic too. If someone comes in and says, oh yeah, I have a history of blood clotting disorder, I'm currently on, you know, Eliquis. Eliquis is a popular one right now. Warfarin, it's like, okay, well, we're not going to do any adjusting. We're just going to do really simple joint mobilizations.
Yeah.
And we can get just as much in that as we can out of the adjustment. So sometimes I have to be really stern with people. This is just for safety purposes, for your own safety.
Right.
Yeah.
So it's interesting you brought that up about joint mobs. I love joint mobs. Ever since I first started like discovering them, the thing about it is that because of my scope, I can't call them joint mobs. I have to call it traction.
Really?
Yeah, in Texas at least.
Oh, okay, that's interesting.
Yeah. So like if I'm working on somebody, and it makes it even worse if I have like a mulligan belt. But
I love the mulligan belt though.
Yeah. But if I'm like working on somebody, I can't say we're just trying to mobilize the joint here. I have to say, oh, I'm just stretching out the joint. Like I have to. It's linguistic gymnastics in Texas. It's really it's really stupid. Yeah.
God. No, I love joint mobilization, especially take a person. Let's say cervical region, for example. There's a lot of people out there that don't like their necks adjusted,
right?
And that's okay. It's not required when you come into my office. At least, if you don't want your neck adjusted, great. We're not going to do it.
Yeah,
we're going to do joint moves. We're going to work through that, cervical paraspinal, suboccipital region, rotation, lateral, bilateral, lateral flexion, sometimes a lot of flexion extension work. And that gets the same amount of work done as an adjustment would.
Yep.
Some people may argue that because there's a lot of straight chiros out there that say, COC1.
Yeah.
But it's all about that adaptability.
Yes.
Patient doesn't want it, cool. You need to find something else.
Exactly.
That's the difference between good and bad practitioner, or not good and bad, but great and moderate practitioners.
There is an interesting it's not an adjustment, but what it is, it's a muscle energy technique. I don't know if you've ever heard of it, shotgun method. Yeah. And as soon as I did this, you were like, oh, I know what he's talking about. Yeah.
I have another guy. There's a personal trainer down the street from me that does it.
Oh, wow.
But it's funny because in the state of Washington, my understanding is personal trainers can't put hands on people.
Right.
And this guy does, so I'm like, okay, I'm just going to let you do.
Right. Yeah, that's when you're just like, yeah. I know people like that here as well, where I'm kind of like, oh, maybe just don't say anything. But
exactly.
Yeah. But that's exactly why when people ask me, I'm like, I have my LMT, I have my CSC, I have my CES. Like that way, they're like, I'm not trying to lie and be like, look, I'm a physio. No. It's like I'm not going to diagnose you for anything. And even if I was a PT, I don't think having my own practice that's cash based, I still wouldn't want to diagnose you with anything. You know what I mean? For the most part, I wouldn't want to. If it's not even necessary.
Right.
Like,
no, I'm that same way too. It's like I always tell, because there are some like I have a lot of track kids that come in that the parents just want soft tissue work for them, and they just want soft tissue work.
Yeah,
that's perfect.
That's fine.
Yeah, that's great. And I have my. And they ask me, they're like, "But you're a chiropractor," and it's like, "Yeah, but I also have my master's in sports medicine." So
yeah, exactly. Yeah, like
so it allows me to do everything.
Right. It's like I've had people come into my rooms where they see my cups and scrapers and the Mulligan belt resistance bands, and they've been like, you can. And I'm like,
eye opener.
Yeah, I'm like, what? Yeah. It's like, it's not just
people
these.
walk into my office and they see a squat rack and they're like, "Wait, we can do rehab?" And I'm like, "Yeah,
you can. It's not just you thought you were just gonna come in, get a pop, and leave. It's like, no, dude.
It's also just being nice that way. So you're having all these, degrees or certifications, just allowing you to do so much. Allows just someone to just come to that one. Everything. It's like getting everything in one place. Your PT, your chiro, your soft tissue work. Oh, it's all in one. I don't have to go to multiple different places. So that's what's also nice too.
One thing to backtrack a little bit, because when I was talking about like having a resistance band and different things on the table, because we were talking about frozen shoulder earlier, and I don't know if you've ever tried this, but what I like to do. And it is a bit of a joint move now that I'm thinking about it. But basically what I like to do is I will get a resistance band while the person's laying on my table. I will tie the resistance band to the bottom of the table, and then I will wrap it around the arm. So it's pulling resistance this way. But then I will bring their arm, because they can't reach overhead, right? They have frozen shoulder. So I'm going to bring their arm this way with the band pulling them in the opposite direction.
Yes. Okay. Yeah. So that not distraction, but it's like trying superior motion.
Yes, exactly. Exactly. And depending upon the direction of which I feel like pulling the resistance band for whatever person that I've noticed on specific ranges of motion, I will, adjust it from different ways. But for the most part, I because I know they can't do this, then I want it pulling that way. And sometimes I have seen some success with it. And then sometimes I'll see it with other things, like I'll try it with other things like numbness in hand or whatever, or hips and things like that. But I don't know if you've ever tried that before.
Send me a video, because now I'm curious. I need visuals, but I want to see it.
Yeah, I think I posted one now that I'm like talking about it.
Send it over to me.
It's an interesting thing I like randomly came up with. I can't take all the credit. I got the idea from Casey, that lady Casey. But it was like an old post, and I'm not gonna lie, I was kind of stalking her page because she just posts like techniques, like just different techniques, manual therapy techniques.
It's nice though.
And so there you go. I sent it to you, but that's like me doing it on a guy's hip. See if you get it.
Oh, I see. It's like a resistance technique.
Yeah, so I'm like got it on my table there. Yeah, and hit limit internal.
Yeah. I'm trying to think. Was there a certain injury with this guy's hip, or just
lack of mobility, really?
Lack of mobility. Yeah. Any certain direction, internal, external rotation, adduction, or just all around?
Well, with that, I was like, well, I know if his internals are keeping him from going into that internal rotation, it's worthwhile pulling them. And then I know that TFL and glute med is probably really angry. And a lot of people don't like their TFL and glute med pressed on, I've noticed.
They think it sounds nice until you actually do it.
Yeah. And so as a way to kind of like ease, especially as men, like we're the biggest crybabies, like we really, really are. Just being honest. And so I was like, as a guy, I was like, let me just warm him up with this first before I just start digging my thumb in here. You know what I mean? So that's why. Yeah.
No, yeah. And then you have women that are like, oh my gosh, I need all deep tissue.
Yeah.
And like, great, that's perfect.
Yeah.
Gosh.
But cool. Hey, this was awesome. Thank you so much for chatting with me and like nerding out with me, man.
I feel bad no one else showed up, but
that's cool.
It would have been nice to collab.
No, it's all good. I would like to do these more. I've noticed with things like this, I'm doing them more frequently.